So on this screencast, I just want to add a little bit of depth to what you covered on CICW and add in some more social determinants of health that are going to be particularly relevant to your dietetic practice. So let's start with socioeconomic status and health. So sometimes you might have heard this called social class, social disadvantage. It's perhaps quite an uncomfortable term in lots of ways because it suggests this stairs almost of people that would all sit on different places. But it is important that we consider it because we've known for decades how important it is as an indicator of your likely health outcomes. So it's determined by occupation. So clearly we've looked a little bit at employment. And for children, it's their parents' occupation. And there is quite a complicated classification, which you can have a look at if you like. Just sometimes it's quite interesting to work out where you are on that. But the key thing is that it closely relates to health. So the higher levels, you've got higher managerial, professional roles, doctors, lawyers, teachers. And those people have much better health than those at the bottom with routine occupations, such as maybe people who do cleaning or sweeping roads. And this social gradient that I've already mentioned. And for a lot of people, that will stay the same throughout life. But much more these days, there are things that make us change our socioeconomic status. So I'd like you to have a think about that and think, well, how would it change? And we're going to come back to that a little bit later. But there's lots of different things to think about. And we've known for literally decades how important even small steps up that ladder or down that ladder can be on health status. So I have some thoughts about that. And you might want to just stop the video and think about that and what might influence it. So poverty, we're going to come back to later on this week because we're going to look at food poverty. But let's start by thinking about poverty itself, clearly related to income, but not just that. So what it means is that our resources are well below minimum needs. And you think, well, what are minimum needs? And those are very closely defined as things like heating, food, rent or mortgage, clothing, and being able to pay the bills for things like energy and water. But, our minimum needs also internet these days is a minimum need, a phone of some description, even not a smartphone, but a phone of some description. Many people who are working in the UK, so have got jobs, they are employed, are living in poverty. And that's because of the imbalance between the costs of all of those minimum needs and the income. So you may have somebody with several different jobs, but still living in poverty. And there are certain groups of the population who are more likely to be living in poverty. Retired people, long-term unemployed, single parents with children, multiple children with families with multiple children. So there's lots of different things that influence your chance of living in poverty. And there are lots of different ways of measuring poverty, quite complex, but if you want to have a look at it, there's a link there to provide a bit more information. Another term that you may come across is destitute. So people who are living in destitution. And that is people like homeless people who don't have those basics, such as shelter, heating and clothing. The UK poverty statistics, because they are recorded all the time, are quite interesting and quite heart-wrenching as well. And so we've got this situation, particularly recently, where income has just not kept up with the cost of living. So we have more and more people living in poverty. And that's perhaps part of the explanation for all the strikes and things that we've had recently. People just saying we can't afford to live on the income that we are getting. And have a think about all of those potential influences. There's COVID pandemic and the furlough scheme, which saved a lot of people. Universal credit and the benefit system, loss of businesses, and we've just had another one of those this week where potentially thousands of people are now going to lose their jobs. So the causes of poverty, unemployment, people losing jobs or in low-paid jobs, illness that takes people out of the working environment, people being made redundant, people with low levels of skill or education, it's going to be much more likely to be in poverty. The limits of the benefit system, high costs, discrimination, relationship breakdown, addiction, all of those things are likely to influence poverty. And one of the consequences potentially is going to be homelessness. And it's just important to have a think about that, because we've talked about housing before, but people who are homeless doesn't just mean rough sleepers. The definition of homelessness includes people living in hostels, or supported accommodation and temporary accommodation. And it's really worth thinking about how that affects your ability to eat. Cooking facilities, food storage facilities, all of those kinds of things. And the most recent statistics from Shelter, one of the charities that supports people who are homeless, suggests that we have about 271,000 people homeless in the UK. Those living in temporary accommodation has gone up dramatically in the last 10 years. And not just the fact there are more people, but they are staying in temporary accommodation for much longer. Temporary accommodation often means limited cooking facilities and storage facilities. And there's huge evidence base to show that homelessness has a negative impact on both physical and mental health. And life expectancy is significantly reduced for people who are sleeping rough. So have a think what the physical symptoms might be: respiratory problems, skin problems, often people going into drug abuse or becoming homeless because of drug misuse. There's lots of things that will impact people. And the rates vary across the country, but in most cities you will find people who are living on the streets. London is the worst, but there's a lot of that hidden homelessness that we aren't aware of. People who are sleeping on friends' couches or going from one to another, that kind of thing. And the causes I've already mentioned: poor mental health, addiction, not being able to pay the rent, relationship breakdown. So lots of things affecting people who are homeless. Gender shouldn't be such a big thing as it is, but of course it is still a big issue, and it's a changing issue. So we're looking at what society says of people who are men or women, and of course that is now much more complex, and not as straightforward to categorize or monitor as it used to be. It's massively affected by social norms and culture, and what it is to be of a specific gender. And of course, we don't really have cultural norms as such in the same way for people who may be non-binary or transgender. All of that is relatively new development. So society still hasn't really kind of worked out all of that yet. Women, we know, are much more likely to report illness and much more likely to attend primary care, and that's because it often is more accessible for them, and there's all the different things related to child birth and looking after children. What about men under 45? They visit the GPs only half as often as women. Does that mean they're less well? That they're more healthy? Or does it mean they just don't access services when they perhaps should? Women tend to be lower status, lower income, lower power, lower education, lower levels of participation. So you've still got a lot going on to try and make sure that we've got a better balance of women in high positions in the country. And women are much more likely to be subject to domestic abuse, have more health needs, greater caring and home-making responsibilities, more food-related roles. That sounds almost as if that shouldn't be the case anymore. But it is still an issue and still something that we need to be mindful of, but without making any assumptions. more and more assumptions become very dangerous because things are changing so much. So what about ethnicity? Again, quite a tricky subject. Ethnicity should be self-defined. So the group the person belongs to or feels they belong to because of culture, language, diet, sometimes country of origin or religion. It can be linked with racial meaning. So someone might say they're white Scottish, white Irish. So people might have their own idea of this is who I am and this is my ethnicity. It's highly complex and, of course, changing as people are not into neat boxes again very much as they used to be. And we have this understanding of something called acculturation. So people modify their culture, individuals, groups, by borrowing the traits from another culture. So as people move to the UK, for example, migrant populations, they move to the UK, they will hang on to some of their culture and their understandings of how they want to live their lives, their food, but they will also take on board things from the country that they move to. So you see that change, and you see that change through generations. So older generations, even if they've been in the UK for a long time, and even people who've been born in the UK will hold on to some of their original cultural background and bring some of that into their lives, but take on bits of our culture as well. So a term that I really like that is trying to use explain some of this is our global heritage. So as the UK, we have a very diverse global heritage, and it's in a constant state of flux. As people come to the UK or move away from the UK, people are changing, and the clear barriers that we used to have and boundaries aren't there anymore. So again, ethnicity is a subject that is very much something we need to explore with someone and not make any assumptions about their health behaviours based on their background without checking all of that out. But what we do know is that ethnicity has a profound effect on health. And this is really, again, quite a difficult subject, but we do know that certain people from certain ethnicities are much more likely to be subject to negative impacts of wider determinants of health. So poorer health generally, particularly if they're a minority group, poorer self-rated health, this is how I feel that my health is, more diabetes, type 2 diabetes, more cardiovascular disease, poorer mental health, poorer maternity outcomes. So although it's a complex issue, it is still having an impact, and those causes are multifactorial. So, for example, we know people from a Bangladeshi origin tend to be of the lowest income, the lowest employment records, the types of way they are employed tend to be the worst, and therefore their health tends to be really, really bad in comparison to different groups. So although we can't make assumptions, it's something that we need to be mindful of, that somebody may have wider determinants of health having a profound negative impact on their health and on their health behaviours. So we've really got to explore with an individual where they are, what their wider determinants of health are, not make any assumptions about it, but be mindful this could be having a profound impact on their health and their health behaviours. So we'll be coming back to this in a little while.